right, we're live. Okay, here we are at Facebook Live. This is our first interactive video presentation. We are here at Holistic Healing Arts. This is basically the back of the building where our treatment rooms and our IV suite is. And I'd like to introduce you to Dr. Onkar Singh and Dr. Mary Lee Albano, and they're going to walk us through some of the interesting aspects of IV nutrient therapy. So please, the floor is yours.
Hi everyone, good morning. As Dr. Houck said, this is Dr. Onkar Singh here.
And hi, good morning. This is Dr. Mary Lee Albano. We're going to be speaking about IV therapy, and we're going to do that in our IV therapy suite. So please follow us.
Here we go, through the magic door. All right, so here we are. This is the, there it is, it says IV therapy room right there. All right. And so here's our lovely IV suite. We did some renovations a couple years ago and turned this into a lovely room. We have 5 chairs, so we can put some more in if we need to. So please don't hesitate to give us a call. All right, carry on.
Thank you. IV therapy is basically delivering nutrients by accessing a patient's vein. So these nutrients can include vitamins, minerals, amino acids, to name a few. One of the benefits of IV therapy is that we can deliver concentrations that are not achievable by taking oral doses.
Some of the more common reasons we might consider using IV therapy as a treatment option would be fatigue is common, if there's any digestive complaints. So if you're not absorbing your nutrition by eating or oral supplementation, then we might consider it. That might be something like Crohn's or colitis. Adjunct cancer therapy is another option. We might consider IV therapy. And generalized pain, migraines, joint pain, and many other reasons, but those are fairly common.
Very nice. So our awesome doctors, both Dr. Singh and Dr. Albano, are here to give you a treatment. You sit in the chair, and then they have some bags right there of some wonderful IV nutrients, and that's basically how it starts. So you're going to walk us through some of what you guys do before the patient arrives and then after the patient arrives. So carry on. What's the next step for these awesome docs?
Okay, so maybe I'll let Dr. Albano take you through
Yes.
Okay.
So this is sort of the behind the scenes. Before you even get here as a patient to receive treatment, we'll have compounded the bag for you. So we'll have put it together. So we're going to go into our compounding room and I'll show you what I mean. So this is our compounding space. Everything is done in a sterile manner. So one of the most important things I'll show you here is our flow hood. And I'm going to turn that on. It gets very loud, so I'll try to speak over it. And I'll turn it off again. So whenever we're preparing our IVs, we always do it in a sterile way within the hood. And all of our supplies are here. So we have different bags of different fluids, either sterile water or saline. And our injectables, so we keep some of them, they look like this, either in a cupboard or in our refrigerator. And some of them need to be refrigerated. So we have several options of vitamins, minerals, amino acids that we can use. And the unique thing is we can put together a bag that has the nutrients that you need. So we do that all here, and it's prepared, like I said, in the hood, and then we bring it out into our treatment area when we're ready to go.
So just to clarify, every bag is customized for each unique patient. So the patient gets an interview first, they become, you find out everything that's going on with their health, and then you put together a unique combination of nutrients and herbs and so on.
That's right, exactly. So before this process even starts, we would sit down with you and take an IV intake and determine if IV therapy is even appropriate for you. There can be some considerations, whether it's medical needs or age. Usually at our clinic, we don't do an IV less than 16 years old. So if you're 16 and older, we might consider it. And we do a whole intake, and there's going to be some blood work that we would send you for as well. And we take that history and your blood information and labs, and then can create an IV bag for you that is customized to you. And yes, and this is where it all happens.
Wow, very cool. All right, so we come back out of the what's that room called?
The compounding
The
room.
compounding room.
Right, that's
that's
the
a
tech-
good name. That's a
Compounding room,
yes, technical term. Compounding room. Okay, so now we're back here in the main IV suite.
Hi
so,
again. Yes, so I just wanted to reiterate what Dr. Albano was saying is to receive IV therapy at our clinic, yes, you definitely have to be a patient of the clinic. So as Dr. Albano was saying, we would go through a very thorough intake, your health history, ensuring that you are actually going to be a good candidate for IV therapy. Certain blood tests will be taken at the onset before we even start administering IV. And then depending upon how frequently you'll be receiving IV therapy, we will encourage blood testing at certain intervals as well. So we're always ensuring that the safety of the patient is our prime concern. So as Dr. Haug pointed out earlier, when a patient comes, when we've sort of looked at everything and we determine they are a candidate for IV therapy, they would come in and have a seat in one of these very lovely chairs. And they would sit down. What they would receive would depend upon the case, the situation. We've just given a couple of different examples here. This is a 250 milliliter sterile water bag, and that's a saline, 100 ml saline solution, which typically we'll use for Myers infusions, but that's not a written rule. So when the patient sits down, we're going to ask them, have you eaten? Are you feeling okay today? Has there been any change in your health status? We will take their vitals. So this is a very cool thing that I got on Amazon. These days you can get everything off of Amazon. This is a pulse oximeter. So we stick it on your finger like that. Some of you may have seen this already. So it checks your oxygenation levels, your pulse rate. We would do your blood pressure readings. These vitals are necessary. They are important because if anything is off with any of those vitals, then we'll wait 5 minutes, recheck. So again, we're ensuring the safety of the patient. Once the patient sits down, depending upon what they're going to receive, this is what we call an IV administration kit. I'm not going to open it, but if I were to open this, the tubing, that's what connects into this port here. The end of this would then attach eventually to a catheter. So a catheter is what we use to insert into the vein. This happens to be a 22 gauge 1-inch catheter, which is commonly what we use here. Everything, obviously, as Dr. Albano was alluding, the compounding room, we do it with sterile technique. Obviously, I would be wearing gloves. Before I actually even do the insertion, we would swab the area with alcohol. Once the catheter is in, we would hook up the bag. Typically, treatments can be anywhere from 30 to 40 minutes to even 2 hours when we're doing the higher dose vitamin C.
Okay, so it's a very slow, comfortable drip.
That's right.
So people sit here, they can have a cup of tea, they can read.
Yes, we have our famous curing station here. Yes.
So we have lots of choices, and it's a very comfortable place. I've seen this room full of, every chair occupied, and it's quite a social event when people sit here and they're getting their IV. So that's very cool. What else can you tell us about the needs for IV or some of the successes that maybe you guys have had?
In our clinic, we have seen IV be successful in people. So again, it can range from improved energy, improved digestion, reduction in pain, improvements in quality of life. And we have seen that in individuals receiving cancer therapy as well. So it's a nice adjunct to cancer therapy. And we're seeing better quality of life as they go through that process. So for many different reasons, we actually have seen good improvement using the IV therapy if it's been appropriate.
So some people might come in for a certain problem, and then once things are better and they're doing well, I guess they don't really ever need IV therapy, or are there times when someone might come in once or twice a year for some kind of a touch-up? Would there be circumstances that would require that?
Yeah, so both scenarios where we have them on a treatment plan, maybe it's once or twice a week for a number of weeks, 4 to 8 weeks, and then reduction down to getting down to every other week, once a month. Or if we determine that they just need a touch me up, then they come back in every season or every so often to get that pick me up.
Very good. I heard the word Myers cocktail or Myers infusion. So that's a famous name in the IV circles. What does that mean exactly, a Myers cocktail or a Myers infusion?
So that's named after Dr. John Myers, who was a Baltimore-based physician. And in his practice, he found that individuals with chronic degenerative illnesses like fibromyalgia, chronic fatigue, migraines, when he would administer the Myers infusion, so he came up with a formula with certain dosages that these patients were noticing improvements. So there is a protocol that he's established with, you know, your B vitamins, calcium, vitamin C, magnesium. As NDs, some of us might use the exact same formula, or we may tailor and slightly modify one or more of the ingredients depending upon the situation and depending upon what the case is or what the health concern is.
Very nice. Well, wow. Time has flown. We've spent 10 minutes chatting about IVs, so I think we'll call it a day. But thank you guys very much for your time and that wonderful information. And those of you in Facebook land, hopefully you'll find this of interest. So thank you very much. We're signing off.
Thank you, everyone.
Thank you.